going to wait for a minute to let folks log in, but if you are live, you have logged into the MaxWell Clinic webinar. Today we're talking about Pain Relief Redefined, Discovering Prolotherapy, PRP, and more with MaxWell Clinic is the title of our talk today. And I'm going to wait to start. I'm here with Dr. Scott Stoll. I'll do introductions in a minute. Just some housekeeping issues. Your mic is muted, so throughout the presentation, but if you have questions, go to the Q&A at the bottom of your Zoom screen and list, type your questions in there, and at the end of the educational time, I will try to get to as many questions as we have time for. So, okay, you ready?
I'm ready.
All right, let's do it. Well, first of all, I'm really excited to be doing this with you because I am wanting to learn more about all the services that you provide. I know what they are. I haven't experienced them personally, but I have had family members that have experienced them. So I am excited to talk about it because a lot of people have pain in their daily life. And you know, your frame is what you ride around in all day, every day, and it can limit you. So, okay, first of all, introductions. My name is Dr. Ashley Woods, and I'm honored to be one of the MaxWell Clinic clinicians here. And I'm joined here by my colleague and friend, because we do plant potlucks together. We'll talk about that later. With Dr. Scott Stoll. And we were, like I said, today be discussing regenerative injection therapies as treatment for pain and injuries. And we will discuss how harnessing the power of all natural substances, as opposed to surgeries and meds, can empower the body's innate healing capacities. Regenerative injection therapies have the potential to heal, reduce inflammation, and improve function.
That's right.
And give you your life back.
Give you your life back. Right. So exciting.
Right. And so Dr. Stoll has a very impressive introduction. So I'm going to read some of this because I didn't think I could remember it all. But he is an international leader in lifestyle medicine and board certified physician specializing in sports and regenerative musculoskeletal medicine. He has provided care to Olympic and professional collegiate athletes, as well as royal families in Europe and Middle East, the Middle East. He is the co-founder of Plantrition Project, an international plant-based nutrition healthcare conference, the International Journal of Disease Reversal and Prevention, and the Regenerative Health Institute, a unique collaborative project with the Rodale Institute that integrates regenerative vision of human health, agriculture, and the environment.
You got it.
That's very cool. That's very cool. And here's a fun fact. He was a member of the 1994 Olympic bobsled team and served, so he's an athlete, and served as a team physician for the United States bobsled and skeleton team in Lee University. He's also served as a member of the Whole Foods Scientific and Medical Advisory Board and consults with healthcare organizations globally to integrate lifestyle medicine solutions. And every year you go to Florida and do these immersive 1 week, are they retreats? Are they
like a retreat?
Like
it's a healthy retreat, right?
Or a conference? Is it a conference?
No, it's a retreat. It's where sick people come to get well.
Okay, that's awesome. And it is, what is that called?
Total health immersions.
Total health immersions. That's very cool. And that's in Florida once a year. And you have also authored numerous books, scientific articles, has speaking engagements internationally, and appeared on a wide variety of national shows, including Dr. Oz, hosted a 2018 PBS special, Food as Medicine, and numerous documentaries, including The Game Changers, Eating You Alive, Disease Reversal Hope, Plant-Wise, and upcoming Revive TV series. I want to hear more about that one. So that's a long and impressive introduction. So we are speaking with an expert here, folks, and I am very, very privileged to get to work with this guy. He is right down the hall here at MaxWell Clinic, and what we do here at MaxWell Clinic is we're not an ordinary clinic. We're a functional medicine clinic, and we were, in fact, named the best holistic clinic in Nashville in 2023. because we believe here at the clinic that your body is designed to heal naturally. We do use medications and regular therapies, but we really try to focus on what the person needs, what their symptoms are, and what the whole person needs and their environment, because the environment, when you agree, plays a big role in all of the things with injuries, with food, with how you sleep. That's a big focus for us. And so what you do pairs really well with what we do, because we're always talking about diet and exercise. But if somebody's injured and in pain, they can't move, it limits what they can do.
Right.
I can't tell you how many patients tell me, oh, yeah, I used to run, but I hurt my knee and I just haven't done anything since because it hurts.
Right. And when you don't feel well.
And you don't feel good. So I get that. I mean,
then you eat the junk food because you don't feel well.
Right. I get that. So it's all related. It can snowball, and it can snowball backwards as well.
Snowball backwards.
Yeah. And I think that's what you've created your whole life around. So I'm
right.
excited to hear about all the things that you do. But the bottom line is we are both here to help patients have better and more good days.
That's right.
On a regular basis. So let's get to it. Regenerative injection therapies. Now you do lots of these here at the clinic. Some are ultrasound guided,
right.
but what are they? We're talking about prolotherapy, PRP, and injections with biological substances.
Growth factors.
Yeah. So let's kind of break that down. You can start wherever you want.
Yeah, I'll give you just a little history of how I even got started in this.
Yeah.
When I was practicing, I was in a large orthopedic group. And so, the patients would either go to surgery, or if they failed everything, they would go to Dr. Stoll's office. So I started getting all of these athletes and patients that failed traditional orthopedic care. They were limited by pain, taking medications like NSAIDs that create ulcers, disrupt the microbiome, and lots of other problems, absorption issues. And they were depressed and frustrated. They didn't know what else to do. And so I started to look for solutions. And I found first, this was back in probably 2003, I found that prolotherapy, which has been around a long time, since the 1950s. And prolotherapy is an injection of a little bit of sugar. I always joke with people, this is the only time that sugar is good for you.
Sugar.
Yeah, that's right. The only time.
Sugar.
So it's a little bit of sugar and numbing medicine. And the process is you inject down onto the ligaments around any joint or into the tendon. And it creates a little bit of inflammation. And oftentimes, we hear the word inflammation and we think inflammation is bad and we don't want inflammation. But as you said earlier, the body was created to heal itself.
That's the natural design. You get inflamed, so the body takes the healing properties to the injury.
Right. If you twist your ankle, it swells up because your body's trying to fix the damage to the ligament.
Yeah.
So with prolotherapy, that's what we're doing. We're just trying to inject something that creates inflammation, so the body will come in and pay attention to an area that has been chronically injured or damaged.
Yeah.
And so through the course of like 4 to 6 injections, you can strengthen the ligaments. And the research shows that the ligaments actually get stronger and tighter. And so even in a degenerative joint, if it's been loose and sloppy and shaky, the ligaments tighten up and hold it so you don't get that slippage and pain. And it's a very effective treatment for things like whiplash, chronic low back pain. It tightens things up, SI joints. It's a beautiful injection and it's elegant. And when people are finished with their treatments, it's long lasting.
How many, I'm going to ask questions as we go. These may be some questions that come up in y'all's minds as you're listening. How many injections, if you're doing the prolotherapy, would you say I have a SI joint issue? How many injections? Is there a standard, or is it a one and done?
Yeah, typically, because we're trying to help the body heal itself, it takes about 4 to 6 injections.
Yeah,
so we're injecting a region, all the ligaments that support like an SI joint or the lumbar spine, we're injecting those ligaments. And each time they heal and get a little bit stronger and tighter. So over the course of 4 to 6 injections, things heal up. Occasionally, in really severe conditions, it can take a few more. But generally, by 4 to 6, people are doing well. And then we transition right into kind of some functional fitness to come back and strengthen the muscles bring some postural balance and realignment to the body.
Like physical therapy type.
Yeah, but more like looking at the body as a whole. Sometimes physical therapists say, oh, you have back pain?
Right.
Let's fix your back pain.
Right.
But they don't step back and say, oh, let's look at the body from the feet up and
Like
see what else.
Like a functional assessment.
Correct, like a
Gotcha.
full functional assessment, looking at the body as a whole.
Gotcha. That's fascinating. And then, so that's the prolotherapy with the sugar water.
Yep, exactly.
And then there's the platelet-rich plasma, or otherwise known as PRP therapy. And people may have heard of professional athletes getting that done when they're injured to get back on the field. But can you talk about what that is? Sort of describe it, what the process is. Give us a little bit of information on that.
Yeah, we have, PRP has a very interesting history too. The dentists were using this back in the 1980s for gum surgery to help gums heal. In the 1990s, the cardiothoracic surgeons, the heart surgeons started putting PRP on the incision along the sternum to help the sternum heal after they do bypass surgery. In the early 2000s, the orthopedists said, well, if it's working to heal those, why can't we inject it into tendons, ligaments, and muscles? So in the early 2000s, PRP was started to be used to help heal the body. And essentially what PRP is, platelet-rich plasma, so the platelets are a part of the blood. And it's a way to use your own body's healing growth factors to heal damaged tissue. Right. So the process is we just draw some blood, we centrifuge down the growth factors, and then we can put those in a syringe. And so sometimes we can do it without an ultrasound, and sometimes, like the rotator cuff, we would use the ultrasound to see the tear in the rotator cuff and direct a needle right into the tear, and you can inject the tear with the platelet-rich plasma. And then it's loaded with growth factors, and it attracts your body's stem cells to the area to begin repairing that damaged tissue. And you can follow this over the course of time. 1 or 2 injections, you can actually watch the ligament or tendon heal on the ultrasound.
That's so cool. That is really cool. And on average, how many injections would this be?
Typically 1 to 3. I mean, there are some cases where 1 injection takes care of it. I know your husband and son had this as well.
We were talking before we went live about my husband and son both have had PRP in the past, and they both just had a single injection, and it worked great. Knees, we were talking about knees. But this could be any joint.
This can be any joint. It can be whiplash in the neck. I just treated a patient that had, 40-year history of neck pain. And after this was the second PRP, he's doing much, much better. First, 75% reduction in medications.
Wow, that's amazing. Because downstream, that has so many other effects. If you are taking NSAIDs, meaning Advil, Tylenol, ibuprofen, chronically, because you're trying to get through your day, that's doing bad things to your gut microbiome, to your gut lining, can even cause ulcers.
It can be a real tipping point for people with chronic injury.
It really can. And that
sleep, diet, microbiome.
It's a slippery slope.
It's a slippery slope.
Yeah. And so, and then you also do some other injections of more natural, well, not more natural, because PRP is natural, but other natural products. Can you talk a little bit about those?
Yeah, sure. So, there was the process of prolotherapy, PRP, and then stem cells. We started to do autologous stem cells, which is pulling stem cells out of your body from the iliac crest, the bone in your back.
Which is painful, by the way. I've never had it done.
You have to drill through the bone.
I've heard it's not a pleasant thing.
Out. Yes, it's painful. And then inject those in. And one of the challenges with using your own stem cells is as you get older, your stem cells become less effective.
Old.
No,
as I'm getting old, I can say old.
Just like the gray in my beard, they're not as youthful as they used to be.
They're not like baby stem cells. So
they're not as effective. And so kind of a step up from that is these growth factors that come from donated placentas. And they are able to take the growth factors, these tissue products, and inject those. And they're multitude factorial stronger than stem cells.
Wow.
So we can inject those for like larger cartilage issues in the knee, for shoulder issues. I can tell you a good story on that one. And they're very effective at reducing inflammation and attracting your own stem cells and growth factors to really heal that part of the body.
So that's really using your own body to, it almost like wakes up your natural healing process. Is that
That's really a good way to
think
describe
about
it. Yeah, it
Kind
sure
of like
is.
pokes your own immune and healing
Says, wake
process.
up, come pay attention here.
Don't forget.
Yeah.
Yeah, no, that's awesome. And so that seems like it is a little bit of a more powerful therapy because
Yeah,
you're
yeah.
using younger tissue, if you
That's
will.
correct. Yeah, it's a big step up.
Yeah, so that would be like top shelf of what you need. And so how do you differentiate if somebody comes in, say I come in with a bad shoulder and I have several micro tears in my rotator cuff, which happens, in case you don't know, over time as you age, you don't have to have a big injury. How do you decide which therapy is the best therapy? Is that patient dependent, age dependent? How do you make that?
Yeah, all of those. Some of it is age dependent. Even PRP can be less effective as we get older. So if somebody's a little bit older, probably my age,
Probably my
55,
age,
yeah, then PRP may not be effective for a more significant injury, and we would need to give it a bigger push with the growth factors. For most people, if you have micro tears in the meniscus in your knee, in your rotator cuff, tennis elbow, golfer's elbow, typically 1 or 2 PRPs will resolve that condition. If there's a bigger cartilage issue where you've lost cartilage or had a bigger cartilage tear or a bigger rotator cuff tear, the tendon in the shoulder, typically I will do the growth factors because I know that it will need the bigger push for that to heal.
Right. And what about smaller joints like in the wrist or TMJ? Are those things that would be appropriate for this type of?
We can certainly use those in smaller joints. I've used them, in the big toe, in the thumb. TMJ, with some people with chronic TMJ, you can do either PRP or the growth factors, depending on the severity of the joint damage. But it's very effective.
Well, I wanted to mention the TMJ because a lot of people have that, and we had a meeting and you had mentioned that as something that you do. I'm like, oh, I didn't think about that for TMJ. Because when these are sort of advanced therapies, I mean, they're sort of out of the box therapies. They're not done in standard orthopedic offices as you described because it was surgery or Dr. Stoll. And so they're different, and they're different in a beautiful way because they use the natural healing properties of the body. Some concerns that people may have is like, oh, placentas, is that, how is that screened? How do you know that placenta doesn't have a disease? I mean, it's, there would be concerns about that, I would think might come up in people's minds. So how is that?
It's a very good question.
How is that?
The company that we use is one of only 129 registered tissue banks in the United States. So they've gone to the highest levels of managing screening. All the tissue is screened multiple times for everything. And so it's verified by the process and by their tissue bank status as being free from any foreign substances that would be harmful to the body.
And important.
And very important, absolutely.
Yeah, that's very important. Are these procedures painful? I know the answer, but I don't know that our audience does. So I'm gonna let them. I don't know from first experience.
Yeah, so that I always tell people a couple of things. One, I'm going to be honest with you and not tell you it's not going to hurt.
Sure.
Doctors are sometimes bad about that. This is not going to hurt. It's only going to hurt a little, and it actually hurts a lot.
Yeah.
So I tell people, yes, it's going to hurt. This is pain with a purpose because we're actually helping the body pay attention to something that needs attention for healing. I will use a lot of numbing medicine, so I'll numb up the area very well. So there may be some initial pain with the numbing medicine, but after that, it's not painful.
And then what about after?
Yeah, post-procedure, if we're doing prolotherapy or even PRP, there can be a little bit of inflammation, and for 2 to 3 days, it may be sore, like a mild flare-up. But then after 2 to 3 days, it really starts to get better.
Okay.
So,
yeah, and that was the experience of my family members that have had this done. I say this, had PRP done, is that the day of, they're like, no, it's fine. And the next day they're like, oh, it's a little sore. But continue to improve over time. It wasn't a quick fix, but with time and letting the body heal. I mean, just like if you scabbed your knee or, skinned your knee, it's going to take a while to the body to do its thing.
Right. If you break your arm, we put it in a cast,
Right.
and in 3 months, the
Give it time.
bones heal together. And the same thing with these injections that, it's 3 months to get any kind of tissue to really start healing. But it gets better over time. And I always like to draw a graph because I think it's valid for all healing, that we wish healing was like a straight line up.
Yeah.
But it's more of it's like this undulating wave where you have good days and bad days, but over time, the bad days are even much better than the good days used to be. And when you have a bad day, I always try to help people understand it's actually when the body is paying attention to the area and chewing up damaged tissue and laying down new tissue. So the soreness is actually a good thing. It's kind of resetting the mindset around pain.
Right. And you have to reset people's mindset around pain as well, because I know, because exercise is really important to me. It's just something that I talk to my patients about, talk to my family about, and it's something that I do. And if I am sore or I've injured something, because I do that frequently, not on purpose, I just have overdone it. I'm mad because I can't go to the gym. And sometimes like, I'll push through it. And you just need to listen to those pain signals and pay attention, and let the body heal, because they are sending you signals. That's the point of the pain.
A really important point that in our society, we've just kind of conceptualized that all pain is bad.
Right.
And we either, ignore it or we try to cover it up. It's like putting duct tape on your dashboard when the check engine light comes on. You just, I'm not going to.
You hear a noise, you turn the radio up.
That's Advil, that's Tylenol.
Right.
But what we need to, like you're saying, what we need to do is say, why is the pain there?
Yeah.
What's the root cause? And what do I need to do to actually help heal the situation? Not just cover up the pain or not work through it.
Exactly.
Because it may be like a small tear in the beginning, and we take Advil every day and we keep working, and it becomes a bigger and bigger tear.
Right.
So if you catch things in the beginning and you're attentive to those areas that your body's saying, hey, it hurts in the knee, come down here and see what's going on. We can catch it early. And you may, like your husband and your son, one injection takes care of it because they paid attention early. But had they gone years on that painful knee, sometimes it ends up bone on bone, and the only solution is a total knee.
Right. Right.
So,
and let's talk about bone on bone a little bit, because I have a lot of patients with arthritis, just degeneration. I have family members with degeneration arthritis. Where do these therapies play a role there? Because we've talked about injuries and pain, but what about just wear and tear, because you've had a lot of birthdays?
That's right. Yeah, wear and tear. And, it's wear and tear, it's misalignment, it's not being attentive to the pain signals. Because we don't necessarily develop arthritis just because we're old.
Right.
That's always an important thing to realize. I have in my presentations, I have a picture of 2 knees, a right and a left knee, and they're both 86 years old. One is bone on bone and the other one is good. So it's not age dependent. It was misalignment and injury.
I'm glad you brought that up, the misalignment piece, because a lot of people say, oh yeah, my knees are starting to hurt because I turned 50 or whatever the age is. And I'm like, no, I think that's what it is. Like there's something else going on there if your knee is hurting. And I think that's really important. And because Dr. Stoll is very into plants and plant-based eating, and have done a lot of work on healing disease states, as we have with foods and lifestyle, paying attention to your diet, paying attention not only to the pain signals, but to the inflammatory foods. And I think that's one thing, because of the work that you do, that led you, is my understanding. You want to talk about that just a little bit, of how that kind of led you into the love of vegetarian diet, vegan diet?
Sure. And I'll go back and I want to answer the last part of the question, because you asked about bone on bone.
Yes.
That even when something's bone on bone, there are some people that can't have surgery. And so these procedures can help to alleviate the pain and alleviate some of the discomfort. Quick story, I took care of a friend of our family, and he had bone on bone in the shoulder, and he couldn't sleep at night, was sleeping in a lounge chair in his living room, wasn't able to use his arm, work. Went to see the surgeon. The surgeon said, we can do a reverse total shoulder. However, you're not going to gain any more range of motion, and it may not take care of all of your pain. And he said, well, why in the world would I do that?
Right.
So we treated him. I treated the ligaments to hold the shoulder stable with some PRP, and I injected the growth factors in there 2 times.
Mm-hmm.
And now we're 4 years later, and he still has no pain in his shoulder.
Wow.
Went back to sleeping in bed, doing his work, like he loved to do carpentry work. And so, yes, he doesn't have full range of motion, but he also has no pain and didn't have to have surgery. So there are things that can be done for even bone-on-bone situations that can recover function.
That's what it's all about, getting his life back.
That's right.
Getting his life back.
That's right.
That's amazing. And and I wanted to differentiate, sorry, I went on the plant thing because that's something we do, but the differentiation between standard orthopedic, and I'm not poo-pooing these because they serve their purpose, but like the hyaluronic acid, the gels that are injected, the steroid injections, can you kind of compare and contrast your injections versus those injections? Right.
Yeah, and you make a good point. Like, we even at MaxWell Clinic, there's medicine is valuable. We need good medical care, and good orthopedic care is incredibly valuable. Broken bones, surgeries. I mean, we need really good orthopedists.
Yes.
But there's a place in orthopedics where people start to fall out of the traditional treatment algorithm. And that is after they've had, physical therapy, a couple of cortisone injections, trials of NSAIDs, and they're not a surgical candidate, but they still have pain. What do?
Or they don't want surgery.
And like you mentioned, we can't continue to do cortisone injections.
Right.
The cortisone, actually, if it's repeatedly injected into a joint, it injures the little cells that produce cartilage, the chondrocytes. So it accelerates degeneration over time. There's research that shows if you have arthroscopic surgery and they shave too much of that cartilage, it accelerates degeneration because the knee gets a little looser, and you end up with a total knee more quickly after arthroscopic surgery.
Yeah, wow. Yeah,
so we do have to be careful. Sometimes a cortisone injection makes a difference, but most of the time you should be asking, like, why is it swollen and inflamed, and what can I do to not only reduce the inflammation but help create an environment that produces healing inside of that joint. And PRP is often a better choice than just a cortisone injection.
Yeah, I would say so, because it's more natural.
It's natural, and
it's not going to do the damage you were talking about with the cortisone.
Yeah, it's the exact opposite. It's boosting healing rather than injury.
Yeah, that's amazing. Anything that would be a contraindication for these therapies that you do? And I've kind of lumped them in. So if you want to separate those out into PRP, prolotherapy, and the other, are there any contraindications?
I mean, generally for prolotherapy, there really are not contraindications unless somebody has, bleeding disorder, is on anticoagulants that we cannot stop or work around, or if it's an area where you're worried about bleeding. PRP, same thing. I mean, really, it's your own body, so there's, you're not going to have any negative reaction to that. The growth factors, because they do promote such amazing growth, there's a contraindication not to treat somebody that has active cancer.
Makes sense.
I don't actually, it's more theoretical than it actually is a reality of the evidence, but there's never been a case where it's accelerated growth, but just because it's a situation with cancer, we don't treat.
Out of an abundance of caution.
Out of an abundance of caution, that's right.
I understand that. And what about autoimmune type joint conditions like rheumatoid arthritis? Is there a place for these therapies in that type of a degenerative process?
Yeah, that'll bring in kind of our nutrition and lifestyle piece too. That was very good. No,
I jumped ahead.
Oh, you're combining. It's great.
I was excited about the plants.
So when you look at like an autoimmune condition, and we all approach disease this way, we're asking the question, like, what's the root cause?
Why rheumatoid did not just fall from the sky? Like, something triggered this.
Yeah, we're not just treating the inflamed joints and hoping the joints feel better. We're trying to treat the underlying cause so that that's resolved, and then the joints will naturally feel better.
Right.
So as you know, for a lot of autoimmune conditions, it's the microbiome, it's a leaky gut, which goes back to stress, diet, environment. And so
that's what we do on our side of it here.
MaxWell Clinic does such an amazing job of tackling the environment, healing the microbiome, and helping people with lifestyle transformation.
That's
And so over the last 20 years, working in this field, I've come to see that like the more plants that you eat, the more the greater the opportunity for your body to heal, because they're packed with minerals, vitamins, fiber, antioxidants, polyphenols, phytonutrients,
Yeah.
all of those things that buttress your body's attempts to heal and reduce inflammation systemically.
Yeah, and that's kind of the main thing that we do. I mean, it's not all about diet, but it is a lot about diet.
It's
And
always the foundation.
Yeah, and Allison, our nutritionist here, that's what she talks to almost everybody that walks through the door about, is just trying to clean up what you can and what's sustainable. And that's super important, whether you're a vegetarian or not, just eating more plants in general.
There's a lot of meta-analyses that come out, these large studies that look at all the randomized control trials. And multiple of these large studies are all coming to the same conclusion, that to maximize your health, you should be eating 10 servings of fruits or vegetables per day, or 800 grams of fruits and vegetables per day. All the scales, so that the more fiber you eat, the healthier you become. Even out to like 70 to 100 grams of fiber a day.
It's a lot of fiber, but you're absolutely right about that.
And the number one nutritional deficiency in America today is fiber.
Fiber. Yeah.
Only 4% of any age group in America meets the basic requirement for fiber, which is 25 to 35 grams.
I know.
Only 4%.
I know.
So people are not eating fiber, and it's just plants. And it's the fiber plus all the beautiful things that are in plants.
The colorful, beautiful things.
That heals the body.
Yeah. So if someone that is listening is in pain or has pain or knows somebody who has pain or is interested in getting an evaluation, can you kind of walk me through what that would look like? Because you're here at MaxWell Clinic. This is your office. Tell me how that would work. Well, they come and see you and they would get an injection that day, or you would have an evaluation, maybe some imaging,
that's right. You're on exactly.
Yeah.
Someone comes to
know
see
the
me.
answer, but I wanted to.
If you come to see me, I like to do a full evaluation, again, looking for the root cause, not just treating the joint, saying this joint is the problem or the muscle tear is the problem, but looking at you holistically, evaluating posture, alignment, leg length, talking about lifestyle, because that's an important part of healing as well. We're injecting. We want the body's system, which is the immune system, to be as healthy as possible so that it can do its job, which is repairing the tissue that we're calling attention to through the injection. So we'll talk about lifestyle, and if needed, if you haven't had imaging of that area, x-rays, CAT scans, MRIs, sometimes it's necessary to get an updated scan so we know exactly what we're dealing with, and we can see the injury more clearly and identify that and inject exactly where it needs to go.
Right. So it's very precise.
Yeah, this is really like MaxWell Clinic is so involved in precision medicine, individualized precision medicine. And that's what this is. This is not algorithmic treatment.
Right.
This is you're sitting there in front of me.
Right.
We're going to talk about your life, how you got injured, how well you sleep, because that's a part of healing as well, what you eat, get the imaging, do a really good physical examination from top to bottom, and then talk about the best treatment options, which even goes beyond the injection, because it's a lot of times looking at the body and talking about what types of exercise you can begin doing to help restore the function. And
what you're doing is beautiful, and it's also what we're doing. You're not treating the injury, you're treating the person.
That's right.
Because the person is the person that has the injury, and you can't just treat the injury, which I think, unfortunately, standard medicine, and I'm not poo-pooing it because I was trained there and there's a lot of good there, treats the injury. But and I'm glad you mentioned the alignment, because this is something that I've experienced, that if my running alignment is off, then I hurt in a certain area, or my hip flexor gets tight, and then my knee over here gets, hurting. And it's not that I've injured my knee, it's that I wasn't lined up right. And humans are very creatures of habit. So we sit the same way, we sit in the car the same way driving, we sit at our computers the same way, hunched over, and all those things over time, if you're not lined up correctly, cause wear and tear. And that's where a lot of the aches and pains come from as we age, because it's been many years of the same behavior.
That's
Am
right.
I right?
You are absolutely right. And most people today, their shoulders
Yeah, I know.
roll
I want to correct
forward
my shoulders
because we're here on the computer.
Change
And what
it.
that does in the shoulder, it rolls the humeral head forward.
Mhm.
And then when you lift your shoulder, it pinches the rotator cuff.
Yeah.
So even if we inject the rotator cuff, but we don't correct this, it'll continue pinching. So if we inject it, we have to strengthen the muscles that are weak in the back, stretch the muscles that are tight in the front, and then your posture is correct. Then the joint can move normally
The way it
without
was-
impingement.
The way you grew.
That's right.
The way you
So
were
that's
supposed
the
to.
holistic
Yeah.
treatment. That's right.
Well, I think we've covered a lot of things today. Is there anything that you feel like that listeners would want or need to know about the therapies that you do, that we haven't discussed I mean, we just skipped across the surface here, but, any other details that we didn't mention?
Yeah, I think one that's important is that to know there's a lot of research supporting what we're
Yes,
doing.
yes.
PRP has been around since, Prolotherapy has been around since 1950s, and PRP and Orthopedic since early 2000s.
Mhm,
And there's a lot of studies now to show that it's beneficial,
mhm.
that it's safe and effective,
Yeah.
but that it has to be the right selection of the right condition.
Right.
That if you just inject it and you don't do the right rehab or address some of those underlying issues,
That we talked about.
it may not be as effective. So it has to be a part of a comprehensive treatment plan.
Right.
But they're recognized in the literature to be effective and safe, including some of the growth factors that we're using too.
Yeah, and everything we do here at MaxWell Clinic has been very well researched. And
Evidence-based.
we're evidence-based, and we are even doing other types of research here, which is exciting. I'm gonna check and see if we have any questions.
Great.
Because we have a few minutes here. Give me a second, everybody, to look in the Q&A here and see what we've got. Okay, I think some of these we've already answered about how things, traditional orthopedic treatment varies. We did discuss that. And how long it takes to see results from regenerative injection, and that multiple sessions may be required, but not.
Right, we make
Not all the time.
individual decisions,
Mhm.
right?
We talked about cortisone, different from what you do. Yeah. And so I just wanted to say that if anyone else would like to learn more about regenerative injection therapy and what Dr. Scott Stoll does here at the MaxWell Clinic, or would like to schedule an appointment with him, you can text the letters RIT to 615-370-0091, and a new patient coordinator will be available to assist you. So
I also wrote a nice article that's on my webpage on all of these injections, so that they can learn more there on the MaxWell.
Can you share your webpage?
It's MaxWellHealth.com, and then it's my webpage on regenerative injection therapy. And there's a little window there. You can click it and you can download the article.
I should visit our website more often.
We're both so busy.
I haven't looked at our website. So that's fantastic. So yeah. Can you say the link again one more time?
Yeah,
so everybody has.
It's MaxWell, it's the website.
It's our website. Okay.
Yeah, MaxWell Health website under regenerative injection therapy. And then there's a window that is right there.
Opens into
Download the chapter.
Awesome. That's perfect. Thank you so much.
It's been wonderful being here. Thank you.
Wonderful. I've enjoyed this discussion, and just getting to know more detail about what you do. And I look forward to more discussions.
Yeah, me too. Thank you. I'm delighted to be a part of the family here at MaxWell Health.
He is definitely part of the family here. He's our structure guy. We need a structure guy. All right. Well, thank you guys for joining and taking time out of your busy day to listen to this. I hope you learned something, and if we can be of further assistance, we've given you some resources on how to reach out. Thanks.